please spend it with us.
Saturday mornings at 7 on KSJE Farmington.
Thane Maynard here. The 90-Second Naturalist is a compact little radio show with expansive goals to raise awareness and improve understanding of the natural world. To do this, we take just 90 seconds and present stories about the plants and animals around us. The facts are fun, the sound effects are neat, and the host ain't so bad either. Please join me for the 90-Second Naturalist.
Listen every weekday afternoon during the KSJE Evening News at 5:30. KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Ten minutes past 8 o'clock. It is Wednesday morning, August the 11th, 2021. Good morning, everyone. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico. 103.3 FM over the air in Durango, Colorado, and streaming everywhere else on the planet from our website at ksje.com, and that includes your smart speaker, so try it out. Welcome also to our viewers who are watching this visual radio program. The technology is streaming live this morning to the KSJE Facebook page, our YouTube channel, and our Twitter account. We're glad that you are with us this morning, no matter how you found your way to us today. Great to have you along with us. Coming up in the next few moments, we're going to be talking about kids and health. My guest this morning from San Juan Health Partners Pediatrics, Dr. Preston Herrington, is in the studio to talk with me a little bit about kids and health and COVID and vaccines and all that and much, much more. So stay tuned for that conversation, which begins in the next few moments right here on KSJE. Then later on this hour, we'll be checking in with Dr. Mike Haddabaugh, 8:50 a.m. It's our weekly visit to the Encouragement Lab. He will have some more great words of advice for us coming up later on. Next hour, we'll go roving with the arts with Mick Hess. It is our classical music program, and this Wednesday, Mick is playing some music from composer Philip Glass. You'll hear some of that coming up today. 9:06, a special 90-minute edition of Roving with the Arts, which will take us to 10:30. And right on Four Corners, our local and regional author program, Tracy Hales-Vass is speaking about The King of Taos, a novel by Max Evans, and she'll be speaking with Stephen Hull about that book. That's coming up today at 10:30, right on Four Corners here on KSJE. In addition to Facebook, YouTube, and Twitter, we also invite you to check us out on our Instagram page as well. Let's talk about the weather, shall we? It is partly sunny this morning, 67 degrees in Farmington at the moment. We're expecting a partly sunny day today with off and on clouds and maybe some scattered showers or thunderstorms popping up later. The high today, 91 in Farmington, 65 with a chance of scattered showers overnight. Scattered showers again in the forecast for the next several days and into the evening. 93 for a high on Thursday, 92 on Friday, 90 for Saturday and Sunday with overnight lows in the mid to lower 60s. Well, let me introduce my guest who is here with us this morning. Dr. Preston Herrington is back with us from San Juan Health Partners Pediatrics. Dr. Herrington, good morning. Always great to have you here.
Good morning, Scott.
Thanks for coming in.
My pleasure.
How are things going in the medical field? It's been quite a year, I guess. Is that an understatement? Probably it is.
Yeah, I would say it's an understatement.
Yeah,
for sure.
Right. But you were telling me that you've had a busier summer maybe than you've had in the winter, and that's a little bit off of normal, but I guess the whole year's been off of normal. So
Right. This winter was very slow, and normally winter's our busiest season. Mm-hmm. And now, starting in June, we've been very busy. Mostly kids.
Right.
Sports physicals, that sort of thing, but a smattering of illness as well.
Got you. And you and I talked before we came on the air this morning about the fact that really there was no flu season to talk of this last flu season because I think of all the other things we were doing in relation to COVID-19.
Exactly. All the measures we were taking, wearing masks, social distancing, we had lockdowns and that sort of thing, geared towards the COVID-19, but flu, RSV, croup, all of the usual late fall and winter and early spring viruses really didn't make a showing
right
this year.
And I guess that's a good thing, and may happen again this year, depending on how things go, right?
Right, it's hard to predict. Normally, if you have a light winter, then the next winter tends to be a heavy winter. But that was pre-COVID and pre the precautions that we're taking. So it may be that we have another light winter if people are not sending their kids to school sick, and if kids are wearing masks, social distancing, all of that. So we'll have to see.
Right. Well, let me ask you a bit about COVID and some of the things that we're hearing about. Of course, school is just about to start, and so folks are very concerned about sending their kids back to school. The school districts certainly in the state talking about masking mandates in the schools. Vaccines, of course, are now available for children 12 and older. So give me your impressions on, let's start with vaccines, I guess, and just how effective they are, because I think we can see in the numbers how effective the vaccines are, because our cases, while going up, are certainly nowhere near where they were during the previous surges of COVID-19. And give me your thoughts on that, Doctor.
Yeah, the vaccines are really excellent compared to other vaccines. The flu vaccine, which we always recommend, has never been as effective or efficacious as the COVID vaccine has turned out to be. And even with the changing variants, which everybody knew would happen with ongoing pandemic, the Delta is the one in the news now that's more contagious, and yet the vaccines still hold quite well as far as preventing severe illness, hospitalization, and death. So it may be becoming a little bit more like people at the beginning always said, oh, this is just the flu. Not true. We're in a little bit more like the flu situation now, where you have a vaccine that can make it where if you do catch it, it's a milder illness.
Right.
And you're less likely to even catch it in the first place if you're vaccinated.
Right. But if you don't have the vaccine, and I guess this is kind of the stories that maybe we're seeing, we have a lot of folks that maybe have suddenly changed their tune, and they go to the doctor or the nurse, and the nurse are like, we're sorry, it's too late. Here you are in the ICU, and
Right.
It's too late for you to get the vaccine. We hope you pull through, but we're doing all we can.
Right, exactly. So the message is out there. I think everybody probably knows that the experts are recommending the vaccine. It's just a matter of whether they trust the experts more or whether they trust other sources of information.
Right.
Say.
Understood. and then, as I told you, I think earlier too, we've always said, if you have any questions about the vaccine for you and your health or your family's health, talk to your primary care provider, your personal physician, because they're the ones that know about your health history, medical history, and that of your family. That's the person I think you should be asking these questions to, right? Not the internet.
You would think, right?
Yeah,
that would be the hope. And I've come to realize how few people across the board in my life actually care about my opinion, but most of my patients do still care about my opinion.
I would hope that they do, and I do, because you kind of do your research. I think you're very well read, and and you know your patients.
Right. So
that's the
some
idea.
of them, even though they appreciate my opinion, it doesn't trump that of other sources that they're getting. But a lot of them that are sort of on the fence, they really do care what I have to say about the vaccine.
True. Well, fair enough. But I think it's important to seek out those local experts and the people that you do trust to get some of this information. Let me ask you too, Doctor, about masks, because that's the current issue as well with kids in school. And so again, we've got parents I know are understandably concerned if their child is under 12, not yet eligible for the vaccine, yet they're about to maybe send their children back to school. Can the mask be a good protection for those children?
Yes, and so it's not. I think it's too simplistic. I even have colleagues who say, "Well, masks don't work," and I think it's a little more nuanced than that. If you're wearing a seatbelt and you drive 200 miles an hour into a concrete wall, the seatbelt may not work, but in general, it provides a level of protection. It cuts down on the transmission, and so if all the kids in the elementary school class are wearing masks, then the chances of them spreading the COVID goes down.
Thank you. And that was a great analogy, I think, too, and I appreciate that. And I think a lot of folks maybe still today, even after we've been in this for 18 months, misunderstand the meaning and the reason behind the wearing of masks. It's really to protect others around you in case you are infected and spreading the virus. Maybe you don't have any symptoms and you don't know that you're spreading the virus, but it masks your mouth and masks your face, and so you're not spreading that virus out into the air, those droplets, as they were, that can be stopped by a mask, right?
Yeah,
Even the virus is smaller than that, but the droplets are stopped.
Right. Yeah, exactly. And some people, you see all kinds of stuff on social media. Well, the viruses are small enough to get through the pores of the mask, and that's technically correct. But viruses don't travel one at a time. They're attached to droplets of saliva or mucus, and so those are the droplets that the mask will cut way down on, leaving our mouths. It's funny, in Asia they get this. There's really no controversy. They've been wearing masks for decades, really, if not before, but certainly when the SARS epidemic happened, right away they got on board with that. There's still some pushback here for reasons that are a little bit mysterious. I think it comes down to bad information, unfortunately.
Right. Yeah. But the medical studies and evidence is pretty clear, right, and indisputable that this is how they work, this is why they work, and end of story.
Right, and if you look in terms of populations and probabilities, it's not 100%, but it's sort of like wearing seatbelts. If you have lots of people wearing seatbelts, the number of people who are actually hurt severely in an accident goes down. Same thing. If we're all wearing masks, then the transmission goes down. And eventually, I think we'll all either catch the virus or get immune from a vaccine. So the goal is not, it may be realistic to say that it will protect you for life, but it may slow the transmission enough down so that you can buy time, which has already happened for those of us 12 and older. We've had an opportunity to get the vaccine, and that's a few months away for younger kids, I think.
And I was going to ask you that next question, Dr. Herrington, was you're thinking that the vaccine will be approved for children younger than 12 in the coming weeks or months?
I'm assuming so. They're still studying it, and I suppose if there was side effects or complications that came up in the studies, then they would put the brakes on it. But assuming that it stays as safe as it has for the other age groups, then I've heard speculations the very end of this year or maybe early next year. That kind of hard to predict. That kind of
sure
depends on the powers that be.
Understood. And the other thing that we're waiting on too is that FDA approval has been, the vaccines have been authorized for emergency use, which is why they've been rolled out so quickly. The next step, I guess, would be this FDA approval of the vaccines, and that is another thing that's being looked at. And I guess just comes along with time and studies and just making sure that it is what it says it is.
Right. I'm not an expert on what the whole process is. I just, as a citizen, I'm a little surprised that it has taken that long. We've had tens of millions, maybe 100 million doses, so we have plenty of data, as well as the studies before it was released. I do think once it's FDA approved, that will give a little more leeway for employers who want to mandate the vaccine for their employees. I think the lack of FDA approval has been one of the reasons that they've been hesitant to do that.
Right, but that should be coming here in the next few weeks, it sounds like, or months perhaps. So
hopefully, yeah.
We'll see what happens. That's true. And with this whole technology, with the development of the vaccine, again, one of the fastest vaccine developments that we have seen, does that give you kind of hopeful feelings for the future as this technology becomes more used, that maybe some other things that have been stymied, that kind of had stymied doctors about trying to find cures for or treatments for, perhaps the same technology can be used in some other areas of medicine?
Yeah, I'm kind of excited from, at this level it's probably rumors, but the notion is that if you have an mRNA vaccine, you could pick a number of viruses or even cancers that have a certain antigenic picture or a certain target, and you could design an mRNA for that. And so it would be a silver lining on this cloud if 10 years from now we have a bunch of vaccines for cancer that we wouldn't have had otherwise if this had not been such a massive effort. And it's one of the things that can make you proud to be an American, how fast this vaccine rollout happened.
Right, very true. And how effective it has been. You mentioned that too. These vaccines have effective rates higher than even the flu vaccine, which we're all familiar with. And so, 90% plus or whatever it is has got to be pretty amazing, I think, when you talk about vaccines in the history of vaccines.
Right. I think before the vaccine came out, people were hopeful that it might be about as good as the flu vaccine and that it might be a couple of years before it was out. So it came out to be highly effective and arrived on the scene much faster than anticipated. So that was very, very good news.
Very good. And, of course, we've had vaccines for hundreds of years in some cases, if I'm not mistaken. And so, kids get them every year to go to school. There are those normal vaccines that we all hear about, and we've all have gotten over the course of our lifetimes. And so, it is something that I guess some of the controversy just confuses me a little bit about why we're so seeing this all still with the science that is out there. But in your practice, again, you've had folks coming in, obviously back to school and vaccines. That's a normal part of your day-to-day work, isn't it?
Absolutely. As long as I've been on the show, that's one of the biggest things that's important to a pediatrician and other healthcare providers who take care of kids. One of the most important things we can do is give them protection from the childhood illnesses that our grandparents had to just live through.
Right. And a lot of those we don't even hear about anymore, right? We were talking, too, before the program about polio and things like that, it's pretty much been eradicated in this country and most parts of the world. Right.
Polio is on the verge of being eradicated in the world, but there are certain hotspots where there's poverty and war and things like that where it doesn't ever seem to quite be eradicated. But in this country, there's no polio. Diphtheria I've never heard of a case. Measles, of course, there's every now and then there's an outbreak. Measles is probably the most contagious disease we know of. And so a few years back, there was the whole Disneyland measles outbreak where people then took it back to their states, and we had a little bit of a surge there.
But we don't hear about it because I guess the vaccines work.
Exactly.
Very often, right?
Right. And of course it varies. So some vaccines like the measles vaccine are extremely effective. Others like the Pertussis vaccine, the original Pertussis vaccine was a whole cell vaccine that had lots of fever and other side effects and worked pretty well. And then a decade or more it was replaced by the acellular Pertussis, which is a little cleaner and fewer side effects. But unfortunately the vaccine the benefit doesn't last as long, and so you may have kids who it's been 4 years since their last pertussis vaccine, and they may catch pertussis. So it varies. Yeah, some vaccines are super, and some vaccines are pretty good.
Understood. Got it. And we were talking before, too, that your office has a kind of a vaccine policy that you've been trying to explain to some of your patients as they come in, and kind of how that works, and working with families that are coming in. Maybe take a minute to explain that to us. Right.
Yeah. We unfortunately the way we rolled out the policy caused a lot of misunderstanding and anxiety in the community and among our population. So the policy is geared for the 1% of people who are strictly anti-vax. So they have no intention of vaccinating their babies. They have no intention of getting the shots that you're required to enter school. And so our policy is that there's a window of time if we have those people where we can have a conversation, but if they continue to have that opinion, then we will release them because it's such an important part of our philosophy of medicine that a long-term relationship really isn't possible. Unfortunately, people got that announcement, and the 99% who have already gotten those vaccines thought that we were talking about flu shots, COVID vaccines. There's an HPV vaccine that's not required by school, and so there was a kind of a panic that we were going to be discharging people if they weren't getting those vaccines. And while we recommend all of those, that is not what the policy is geared toward. It's geared towards the 1% who's strictly not getting the routine vaccines.
Not getting any,
right?
I guess, and so that I guess means that they're not maybe a good fit for your practice.
Right. If they don't trust us on the vaccines, then there's a certain amount of trust you have to have between the patient and the healthcare provider. And if we don't have that trust, then they should go to someone that they have more trust in.
Fair enough. Well, thank you for explaining that. I think that's good to hear from you and well explained. And certainly, if folks still have questions, they can call your office, I'm sure, and talk to and your staff can talk to them individually about what this policy means to them.
Right, exactly.
Very good. Let me ask you a bit about back to school, Dr. Herrington, and for kids maybe that have been maybe not on the athletic fields as much. I know you do a lot of sports physicals and things like that. You're still doing those, of course, but anything for kids maybe whose bodies have been a little bit more on the couch than on the field over the last 18 months as they try to get back out and get more active? Anything to be careful about for spraining and breaking and things on that line?
Well, I guess I don't have any specific worries. Mostly, I think everybody is excited to try to have in-person schooling. At least half of my patients that were doing remote learning through Zoom. It was a real struggle. Some of them feel like they lost a year. And so I think from the Academy of Pediatrics all the way down, the goal really is to have in-person schooling. A lot of kids have gotten onto sort of the teenage time clock where they're still in bed as we speak, and they maybe roll out of bed about 10 o'clock,
Right.
and then they're up till 10 o'clock at night. So this is the time to be trying to get back onto the schedule where, and it's funny, if you have a Zoom class, you can just sort of roll out of bed 30 seconds before and turn on your laptop and you're there, and now it takes a little more planning. You have to brush your hair, get dressed, maybe get on the school bus. So I think that's the biggest adjustment for a lot of my patients, is getting back to where maybe they're waking up at 6 or 6:30 in the morning, and
Very
then
true.
that means they'll be going to bed at a little earlier than they have been as well.
Right. Maybe getting back to that habit. But but as you said, I think all of us are excited that kids can be back in the classroom, and schools, even here at San Juan College, are planning for face-to-face classes in the fall when classes start here in a couple of weeks. So that is exciting. Again, the mask mandates will be in place here at San Juan College until conditions improve, and I guess that's kind of, again, this whole public health conversation about, how do we protect each other? It's really not just about us as individuals when we talk about public health, is it?
Exactly. So individually, as a person who's received the vaccine, I don't have any fear. If someday I catch COVID-19, it'll probably be a cold or maybe no symptoms at all. But if I can carry it, and there's recent data from the CDC that even if you're vaccinated, you can still carry the virus and pass it on. So that's why I'm wearing a mask, especially at the office. If my 2-year-old patient were to catch COVID because of me and end up on oxygen for a week or something, then that would be, that we would all hate that. And so I think that helps people to, if you take the focus off of my liberty and you can't tell me what to do, and think a little bit more of the community and what can I do to help those who are more vulnerable, that may be part of the whole society in Asia as well, as far as why they're not as hung up on wearing masks if it's good for the community. It has been a little bit of a stumbling block for a certain segment of our population, unfortunately.
Right. And there are people even over age 12 who for some reason maybe can't get the vaccine. Maybe they want to, but they have other health conditions that prevent them from doing that. And so, of course, again, protecting them is another thing that would be important to consider, I think, as we go about our day-to-day lives.
Exactly, right. Kind of, and some of them who have been vaccinated, let's say they have lupus and they're on medications to suppress the lupus, and it may just blunt their immune response. So even if they're vaccinated, we don't know for sure that the vaccine is as protective for them. Certainly people on cancer, chemotherapy, and then the young people and the very old as well. And again, we're better off than we were pre-vaccine, but still, it's such a tiny price to pay to wear a mask if it helps cut down on the likelihood of a vulnerable person getting seriously ill. So
Right. And I can certainly understand maybe some folks who are a little frustrated because some of the advice has been changing from the CDC and from some of the other trusted, medical officials as we have learned more about COVID-19. And I think that's the thing that maybe some folks forget, is that this was a brand new strain of this type of virus, right, that we had not quite seen its like before. It's similar to other COVID viruses, but yet it's different in the way that it spreads and in the way that it's certainly so contagious and things along that line. And that's something maybe, again, from the medical field, maybe you can give us some perspective on is, as we learn more about some of these things, advice does change from time to time.
right, that's the nature of science. What we knew, quote in quotes,
Right.
was true a year ago has been updated. And so the recommendations will change accordingly. And then when there's a new strain that is 10 times more contagious, then whereas initially we thought, well, once a certain segment has been vaccinated, we would have no benefit from masks. And now we say, well, if it's that contagious and the immunized can still carry it, now it makes sense again to recommend masks indoors, for example. That's how science works. Everything we know to be true is provisional, and as there's more information that comes in, then it updates.
Right.
And that is frustrating if people are used to saying, well, I want something to be true
Forever.
year after year after year. Well, sorry.
Right. That's not how it works. And these variants, too, is another thing that is anticipated and expected, right? These viruses mutate and change and evolve, and this is where we are with Delta, and now I think there's even more beyond Delta. I think we're down to Lambda in some places.
Yeah.
I'm forgetting my Greek alphabet, but Delta is the one that we're hearing a lot about because it does seem to spread a bit more easily, and so I guess compared to other viruses, I mean, that's why we have different strains of flu every year, isn't it? Because it's a different virus that is moving around the world.
Right. Some viruses like measles don't change. So the measles of 1950 and the measles of today, if you caught measles in 1950, you're still well protected. But flu is classically constantly having drift, and then every now and then there's a big change, like when the H1N1 happened about 10 years ago. And so that's exactly why the flu vaccine this year is not the same as last year, because the strains will be different. And that's how COVID has been. And so HIV is another one. A lot of these viruses will be constantly mutating. And if you happen to get a mutation that is suddenly more contagious, then it will just spread more. And suddenly it will be the dominant strain like Delta is now.
Got you. But again, as you've said, the vaccines have done a pretty good job, a very good job of controlling that spread of even these variants. And we do have science and we do have studies that show that they offer some pretty good protection, even with the variants of COVID that we're seeing now in the world, right?
That's correct, yes. And some specific misinformation, I guess, is out there is that the vaccines are causing there to be more mutations, causing there to be more variants, and that's exactly backwards. Places where, for example, in Vermont, where around 85% of the population is vaccinated, they really aren't seeing much Delta. It doesn't get a foothold. So the way out of this is for us to become immune, and we will sooner or later. Those who are avoiding vaccination will eventually catch it, and those who get the vaccine will be vaccinated. So 5 years from now, I think it will be a less common disease because, like it or not, you will become immune. It's naive to think that you will not get the vaccine and also not catch the virus.
Right.
If you don't get the vaccine, you're choosing to catch the virus.
And I guess my frustration with all this is that if you catch the virus, you really have no way of knowing how serious it is going to be with your particular body, existing health conditions, things along that line. So you really are taking a chance with your health. We've heard, there's certainly testimonials out there from some folks who maybe are overweight and they smoke and they caught it and they had no ill effects, and then you have a relatively healthy person who caught it and now they're what we call a long haul COVID sufferer. Maybe they've got lung damage now for the rest of their life, perhaps.
Right. If you take populations, you can predict who is more likely to have severe disease the older you are, being obese or having diabetes, but there's all kinds of exceptions, and they make it into social media. I don't know how good it is, but someone in their 30s who's very much vaccine gets it, and they're in the hospital. Now they're waiting for a lung transplant, and of course now they're in favor of the vaccine, but they wish they could rewind and maybe get vaccinated 3 months ago.
Right, but too late.
Too
can't.
late, yeah.
And true. Yeah. Just a few minutes remaining this morning, Dr. Herrington, and certainly appreciate you being here. For your patients, again, a lot of people may think, again, mistakenly, that kids can't get COVID, or if they get COVID, they don't get very sick with COVID, or things along that line. Can you just give us kind of an update on children, even below the age of 12, who can't get the vaccine? They are still at risk of catching this, and some do get very sick, and some die.
Right, that's correct. Yeah, so it is still better to be a 10-year-old than to be a 60-year-old if you catch it. So kids will catch it, and around the country, I have not heard in Farmington, we're not seeing this, but starting to have an uptick in Albuquerque, and certainly in places like Florida and Texas where the virus is the population is less vaccinated, and so the virus is spreading more rapidly.
Right,
there is an uptick on kids who are sick enough to be in the hospital. And so it's still, the odds are that if you catch it, you would not be sick enough to be in the hospital. So, but the number of kids being hospitalized is on the rise.
Gotcha.
Sadly.
Yes, but it does happen. And
does
that's
happen,
something
right.
that folks should be aware of.
Right.
Before we go, we've talked a lot about COVID today. Dr. Herrington, a lot about vaccines. I did, if you'll indulge me, wanted to share some data from the Department of Health about vaccination rates in San Juan County. You probably have already seen this, and I imagine you see it all the time, but they have broken it down for the population that's fully vaccinated. This is as of this last week, August 8th. And the numbers that now include 12 to 17-year-olds. And so as we look at there, we can see by zip code, some of our areas are doing pretty well. Farmington 87402 at 60.89%, 12-plus vaccination rate. Fruitland at 84.53%, Kirtland at 100%. Other places, not so much. And I think that's what the Department of Health wanted to point out, that maybe folks in La Plata and Bluefield and Aztec and Farmington 87401, who are all below about 53%, we could probably do more to protect our fellow citizens.
Absolutely. I think this largely reflects our proximity to the reservation. The reservation was hit very hard by COVID and it took no persuading to get the vaccine. So I think that population on the reservation and near the reservation was first in line and has been well vaccinated, and some of the vaccine skepticism or reluctance is more on the eastern part of the county.
Right.
Aztec, Bloomfield, et cetera.
There you go. But I know, again, the vaccines are readily available throughout the county for everyone who wants them. They are free. And again, as we talked this morning, it is about protecting not only yourself, but your fellow resident and citizen. And we certainly would encourage that. And if you have questions, talk to your doctor.
Absolutely.
Very good. Dr. Preston Herrington, always great to have you here in the studio and on the program. Thank you very much for coming in.
Thanks for having me, Scott.
You bet. Great to have you here. Dr. Preston Herrington from San Juan Health Partners Pediatrics, my guest this morning here on KSJE.
Good news, parents and guardians. Social media